Hello, I'm Matt Davids. I'm a CLL specialist at Dana-Farber Cancer Institute in Boston.
Hi there, I'm Debbie Stephens. I'm a CLL specialist at the University of Utah Huntsman Cancer Institute.
So thanks so much for joining, Debbie. And we're going to be talking today about an abstract that you were a co-author on from the ASH meeting that was looking at racial disparities in telemedicine uptake during the COVID-19 pandemic across patients with different heme malignancies. So we certainly know that the pandemic has been hugely disruptive to clinical medicine, especially for our heme malignancies patients and in CLL. And so maybe tell us a little bit about how this study started and what some of the key questions were.
Sure. Well, we have access to a really large database called the Flatiron Health Database. And this is essentially a big nationwide database that pulls information from patients all over the country. It's de-identified, so we don't have personal identifying information about each of the patients. But we have some kind of basic information in that we know how old these people are. We know the date of their initial cancer diagnosis, what subtype of cancer they have, and we have some kind of basic information about, whether they're receiving an oral treatment for their cancer or receiving an intravenous treatment, whether they're receiving it inpatient or outpatient. We have demographics such as their, race and ethnicity, and some additional information about their insurance payment structure.
It seems like when looking at those factors, there were some big differences across different racial groups and ethnic groups as opposed to, like the white population, especially around telemedicine visits. Maybe tell us a little bit more about the key findings there.
Yeah, so this is an interesting study because there are almost 18,000 patients with blood cancers included in it. And when we look at that, blood cancers are more common in white individuals than Black individuals. And so out of that, there were a little over 2,000 patients that were that identified as Black in this study. One thing that was interesting is that we found that the rate of inpatient or in-person visits for Black individuals remained exactly the same throughout the pandemic. Whereas when you looked at white individuals, they had a greater uptick of using virtual visits. And so essentially they were canceling their in-person visits and seeing online. And we know we don't have a lot of granular data about that to say, is it because, Black patients had less access to computer or telemedicine, or what is the exact reason for this? But one thing that is important to come from this is there was a difference between Black and white patients, and we want to make sure that we're reaching all of our patients during the pandemic. And so, this shows us that we either need to do a better job at assisting Black patients at getting hooked in with telemedicine, or just being aware that that this method is not uptaken as well in the Black community. And so we need to make sure that we're providing equal access to all of our patients. And so that needs to be taken into consideration when we're considering, the next wave of the pandemic comes around and we cancel all of our in-person visits, are we completely alienating all of our Black patients?
Yeah, I completely agree. And I think this was a very timely study. I think we had all been hoping that the pandemic was going away and maybe this wouldn't be needed anymore. But as I think we've learned with Omicron, we're seeing very similar issues arising. And so it's very helpful to identify this problem. And that's really the first step toward making it better. So certainly great work on this study. Any final thoughts on this study?
No, I think, I think it's always just a good idea to keep racial disparities in mind when you're planning for delivering equal access to care.
Yeah, couldn't agree more. So thank you very much, Debbie. I'm Matt Davids from Dana-Farber. It's been a pleasure to interview you for this abstract. And thanks so much for your attention, everyone.
Thank you.